Hey guys, good morning, good afternoon, good evening, and whatever time you're listening to. I'm Adhish, and today in this video, I'm going to briefly cover the important aspects of the tumors of the CNS. There is a lot of information to cover, and that's fair game when we're talking about neurology, but we're going to try to simplify it as much as possible and hit you with the high yield facts that you will need to know for your exam. So this is a basic overview of what you will be covering today. We will start off with some basic principles and classifications of CNS tumors and then go over some of the important types of CNS tumors. I've subdivided the types according to the tissue type, that is the pathological classification of tumors, and there are several subtypes for each tissue origin. But we will be focusing on the most common ones. For each tumor, we will go over in general what you will need to know about the tumors, how it looks under the microscope, and some mnemonics for you to remember the high yield facts. To put it simply, brain tumors are masses of abnormal cells within the brain. They can be primary or metastatic, benign or malignant. Only 30% are primary tumors and they're usually malignant. An important thing to keep in mind is that though they are malignant, CNS tumors rarely metastasize and are only locally destructive. They arise about the tentorium in adults, and the most common brain tumors are glioblastomas, meningiomas, hemangioblastomas, schwannomas, oligodendrogliomas, and pituitary adenomas. In children, tumors are mostly infratentorial, and common tumors include pilocytic astrocytomas, medulloblastomas, ependymomas, and craniopharyngiomas. I know it's quite a mouthful to say all these tumors, but we will try to break it down in a simple format and let's see how it goes. Moving on, secondary tumors are metastatic tumors, comprise almost 70% of brain tumors and the primary foci of such tumors are usually in the lungs, breast, and the kidney. They're usually multiple, well subscribed, and are usually present at the junction between white and grey matter. Common symptoms patients usually present with are headaches, vomiting, seizures, increased intracranial pressure symptoms, focal neurological symptoms, and mental status changes. These tumors are graded based on their biopsy sample into 4 grades according to their nucleotopia, mitosis, microvascular proliferation, and necrosis. They can be either grade 1, that are well subscribed, slowly progressive, and are cured by section, grade 2, grade 3, which are somewhat in the middle, and grade 4, which are highly malignant and rapidly fatal. This image should give you a basic idea of the typical locations of the most common primary brain tumors. So take a moment to look through this image. So moving on, let's talk about the different types of tumors. The most common type of neural epithelial tumors, which are the first type of tumors we will be talking about, are gliomas, and these arise from glial cells. They are malignant tumors and are not usually surrounded by a capsule and rarely metastasize. Astrocytomas comprise the majority of gliomas and can be subdivided into 4 grades. You should definitely keep in mind 2 of them, which are pilocytic astrocytomas and glioblastoma multiforme. Pilocytic astrocytomas are benign tumors most commonly seen in children in the cerebellar region. Microscopically, they are cystic lesions with a mural nodule next to the cyst, and microscopically we can see Rosenthal fibers. On the next slide, there are a couple images which should give you a better idea of them. So on the left is what you would see on a biopsy sample of a pilocytic astrocytoma. The arrows which you can see show bright pink bodies which combine to form bundles of intense gliosis which are called Rosenthal fibers. On the right, we have two different sections of a brain MRI, and you can clearly see the cystic lesion in pink and the mural nodule right underneath it. Next, glioblastoma multiforme are the grade 4 type of astrocytomas. They are the most common primary malignant tumor in adults, and it is a high-grade tumor with rapid growth, abrupt symptom onset, and a short disease course, which can be fatal within a few months. On MRI imaging, you can clearly see a necrotic mass with enhanced margins that infiltrate across the corpus callosum. Try to imagine butterfly wings. So that is what histologists say, that it's similar to this type of tumor, so it is synonymously called as a butterfly glioma. Under a microscope, you would see diffuse palisade-like deposits of tumor cells with hypochromatic polymorphic nuclei surrounding the anuclear necrotic lesion. So a mnemonic to help you remember these details is that instead of glioblastoma multiforme, let's call it glioplastoma multiforme. So G for GFAP positive, which are characteristic of all astrocytomas, P for pseudopalisading cells, and M for midline or malignant. Next on the list, we've got oligodendrogliomas, that are malignant tumors arising from oligodendrocytes, which are cells that myelinate the nerves. They most commonly present in middle-aged adults with symptoms such as seizures, focal neurological deficits, and personality changes. They usually localize in the frontal lobe, seen as hypodense lesions with multiple calcifications, as you can see on the MRI. What you would need to remember and keep in mind is the histology of this tumor. A biopsy sample will show cells with an enlarged oval nucleus surrounded by a clear halo of cytoplasm, which supposedly resembles fried egg cells, which, to be honest, I don't really see, but that's what pathologists and histologists say they do. So we gotta go along with it. So the mnemonic for this tumor is egg-themed. So all egg dendroglioma. So they basically speak about the fried egg cells, chicken wire capillary patterns, and calcifications, with calcium. The last neuroepithelial tumors we are going to talk about are ependymomas, which are malignant tumors arising from ependymal cells that line the ventricular system. It is most commonly seen in children located in the fourth ventricle, as you can see on the MRI image, and present with symptoms of increased intracranial pressure and hydrocephalus. The characteristic feature you should keep in mind are the perivascular pseudorosettes seen on biopsy, which are essentially radially arranged tumor cells around several vessels, as you can see on the image. Moving on to the next type of tumors, we have embryonal tumors, and the one subtype that you will need to know are medulloblastomas. It is the most common malignant tumor in children under 12 years of age and are derived from primitive neuroectodermal tissue. You would usually find them as a contrast-enhancing mass located in the cerebella vermis, and which can lead to gait disorders and compression of the fourth ventricle. Unfortunately, the prognosis of tumors are pretty poor as they grow rapidly and may spread into the CSF and spinal cord, which are called drop mets. A way you would remember the key features is with this mnemonic medulloblastoma. So you blast a home run, a little bit of a baseball reference. So blast a home run that are representative of Homer Wright rosettes. Simple enough, yeah? Next, we have meningeal tumors, and the representative tumor of this type are meningiomas. They are slow-growing, benign tumors of arachnoid cell origin. So think about arachnoid matter and you will make the connection. And they are usually located superficially around the meninges. As you can see from the MRI, they are round encapsulated masses that do not invade the cortex but may cause compressive symptoms like headaches, seizures, and paresthesias. Key findings under a microscope are whorled patterns and calcified structures called psammoma bodies, which are important to remember because they are present only in a few types of tumors in the body. So how do we remember all this? This mnemonic should help you out. Men have problems with PSA, which are usually seen in patients with benign prostatic hyperplasia. So men for meningioma and PSA for psammoma bodies, spindle cells on the histology, and arachnoid cell origin. So if you can remember these three things for meningiomas, you should be good to go. I know it's getting a little tiring at this point with so many things to remember, but we've just got a few more to talk about, so hold on. So talking about tumors of the cranial and peripheral nerves, we've got two types to remember: schwannomas and neurofibromas. Both of them are benign tumors arising from Schwann cells, or in the case of neurofibromas, Schwann cells plus fibroblasts. Schwannomas typically occur in the cerebellopontine angle and compress the cranial nerves 7 and 8, which can lead to hearing problems such as tinnitus and sensorineural hearing loss, and sometimes also unilateral facial palsy. An important tumor marker for schwannomas is the S100. Under the microscope, as you can see on the image, characteristic features of schwannomas can be seen. So these are simultaneous occurrence of areas with densely packed nuclei, which are called antennae A, marked A on the image, and scattered or anuclear areas called antennae B. So if you need a mnemonic, remember schwannoma. So SCHW anoma. S for S100, C for cerebellopontine angle, H for hearing issues, and W for winking problems that is representative of the unilateral facial palsy. So moving on to the mesenchymal tumors, we've got just two important ones to talk about. So the first one is the primary CNS lymphomas, which are albeit a rare form of extranodal non-Hodgkin lymphomas, mostly diffuse large B-cell lymphomas, which are commonly seen in immunosuppressed patients, for example, patients with HIV or AIDS, or also in patients with an EBV infection. On an MRI of these type of tumors, we would see characteristic ring-enhancing lesions, and a stereotactic brain biopsy is preferred for confirmation. If you ever get a chance to go into a neurosurgery theater and see a biopsy of this particular type of tumor, I would suggest you witness it because it's a pretty cool procedure. So the second type of tumors, hemangioblastomas, are one of the easier tumors to remember in that they are of blood vessel origin and EPO-producing, which cause secondary polycythemia. Very highly to remember, especially for the USMLE, is that they are associated with the von Hippel-Lindau syndrome. On histology, you will see thin wall capillaries, and on an MRI, it forms a cystic mass with hemorrhagic fluid inside it. So, breaking down the name, you can help you remember this tumor. So, heme for blood, that is EPO-producing, angio for thin blood vessels, and blastoma for a cystic mass. Oof, we're finally at the end. So the last tumor we're going to talk about are brain metastases. So these are the most common brain tumors in adults, so we have left them for the end. What you would need to remember is that they commonly originate from primary tumors in the lung, breast, skin, kidney, and GIT, and form sharply demarcated masses at the junction of the gray and white matter, which can be seen on gadolinium-enhanced MRI. So the symptom onset is usually acute or subacute with rapid tumor growth and present with seizures, focal neurological deficits, and headaches. So the way you would diagnose such tumors is by taking a brain biopsy, and the biopsy would show characteristic features of the primary sites of the tumor. And that's all for brain tumors. We have covered the most common ones and ones that are commonly tested, but there are much more subtypes of brain tumors that you will not need to know at this stage. So let me leave you with this notion that medicine is incredibly large, and so we can only focus on a small part of it and try to discover as much as we can. So thanks a lot for tuning into this video, and I really hope it will be useful for your preparation in your university exams and beyond. Last but not least, don't forget to like, share, and subscribe.